My name is Jesus Navarro. I'm a physician in Tampa. I'm a nephrologist, that's a kidney specialist, and I also practice internal medicine. I have been with Medical Group Services for 16 years. Medical Group Services provides billing services for me. They do all the charges, both hospital and patient charges from office visits. They bill to all the insurances that I participate in. They give me reports monthly on what my accounts are as far as my accounts receivable, what I have received both from insurance and from patients' office visits. They also help with credentialing and managed healthcare. Medical Group Services has helped me with coding. Every year, once the new coding list comes out, they're educating myself and my staff. They're already working with the next year and the changes that are happening now with healthcare. They update constantly my staff and myself via emails with education materials that are given out by Medicare or CMS. Medical Group Services has impacted my practice by liberating me from having the administrative duties of having to deal with the personnel to do billing my own practice. The turnaround for my account receivable is less because they're constantly billing. So therefore, when compared to the way it used to be when I was doing billing in-house by myself, if I had somebody that missed work that day, there was no billing. With them being in charge, they have somebody who's assigned to my account, and they have a backup person or more than one backup person to my account, and therefore I'm not experiencing any decrease in my cash flow. I get a monthly report of my account receivable where I'm able to see that they are in top of billing every insurance carrier that I participate in. There's a breakdown in this report that I can see what the ARs are, not only my total ARs, but the ARs in each individual insurance or patient. We'll give you, breakdown of how much you bill to certain insurance, like how much you bill to Medicare, how much you bill to private insurance, how much you bill in hospital, how much you bill in offices, and it gives you a good overview where you can actually sit down and say, I need to improve in this area. The technology, which is really hard to keep up to date because the changes are constant, they are able to do that. I don't have to worry about the constant updates that are out there. Obviously in the software for billing, that's something they do. Their response is immediate. Every time I've needed them, I've called them, they respond right away, either by phone or by email, sometimes even calling me after hours at home. And as far also as creating specific reports, I do clinical studies, and at time I requested from them the need for specific patient population, and they've been able to give me a report of patients who have just specifically high blood pressure or diabetes, and that's also been a good asset. Ultimately, with Medical Group Services, it has also definitely increased my face-to-face time with patient care, which is ultimately what I as a physician want to do.